What is up, everyone? Thanks for joining us on the Kinetic Innovators podcast. Today, I have Gavin Philipps, Chief Commercial Officer with Egg Medical. And if you're in the cardiology space, particularly interventional cardiology space, this is one of the discussions you're going to want to pay attention to. Thanks for joining me today, Gavin. I was really intrigued by the work and the product that Egg Medical is performing in the cardiology space. If you would, take a quick minute and introduce me to Egg Medical. For those who aren't familiar, it's a relatively new company. Talk about the genesis of the company a few years ago, because it's fairly recent, but you guys have had pretty significant growth since you got started, since the idea is such a good one.
Yeah, thanks, CW, and glad to be here. Thanks for having me on. Yeah, it's you mentioned it. It's a novel new technology, but the problem that we're solving has been around for years. Egg Medical is it kind of started at the genesis of solving the problem for our doctors, nurses, and technicians that are taking care of patients, the frontline workers. And you mentioned cardiology, but it actually goes to anywhere where there's a fluoroscopy C-arm. So anywhere that we're using minimally invasive procedures, so it can be vascular surgery, interventional radiology, structural heart. But it goes even further throughout the hospital. A lot of people probably listening here have been in some of those procedures, in GI procedures, some of the less fun procedures that you do. But anywhere where you're getting fluoroscopy, we as patients are on the table, for a very short period of time. But doctors and nurses are exposed to that radiation all day, every day, 5 days a week for every procedure they're in. And our solution is designed to minimize that. And it's interesting how it came to be. It didn't start out this way. Our co-founder, or our founder, is an interventional cardiologist himself. So he spent 30 plus years practicing, being exposed to this, and realizing, hey, there's got to be a better solution. And so our product actually, now that it's out there in the market, it sits on the procedure table, and it attenuates the radiation. So today, healthcare workers have to wear these heavy lead aprons. I spent some time in the Marine Corps, and we wore flak jackets, and it's the weight of wearing a flak jacket, sometimes 15 to 20 pounds that they're wearing every day. So the risk to radiation is real, but also the orthopedic risk. And what we know after being around for 30 years of doing these procedures is that there's some real effects of these to people. So you have a higher rate of cancer, higher rate of cataracts incidents, radiation induced, higher rate of cardiovascular incidents. We know that people that stand closer to there, a lot of the times the radiation is coming from the left side, that the intima thickness of their is worse in the left side. So there's a lot of reasons why this came to be. And so I'm excited to share a little bit more about that with you.
So basically, anywhere there's radiologic guided imaging used in procedures is what you're saying. It's not just cardiology, obviously. Any kind of procedure where they're using radiology to guide what they're doing, see what they're doing inside the body, you have some applications.
Yeah, that's absolutely right. So I think in the cardiology space, it's gotten a lot more attention, because I think there's been several people who have come to the forefront to say, hey, this is a real problem. Unfortunately, it's probably come to a forefront in the cardiology space because there's been such innovation. They're doing complex procedures that, over time they get faster at those procedures, but then technology changes, and then they go in a more complex case. So when they take a case that used to take 4 hours down to 45 minutes, some new technology comes out where they have to get really good at that, and the cases get longer, so their exposure to that radiation. And I think the interventional cardiology space was really a leader in that. But there's now other societies. In fact, one of the societies, Sky, has led the initiative with this in interventional cardiology, but they've now brought together 7 other societies in interventional radiology, in cardiology, electrophysiology, to kind of say, hey, and I think you'll see this here in the next probably 90 days come out, a position statement saying, hey, now that these are out there, solutions like Egg Nest and what Egg Medical brings to the market, These are things that we're asking people to use, and they should become standard of care. Somebody likened it at one of the meetings I was at to, you don't go buy a car and get the option of having an airbag and seatbelts. Yet we're putting in these fluoroscopy suites, and we're not providing the safest level of protection for our doctors, nurses, and techs. And so that's the goal. That's been our goal, is to protect them so they can do more procedures, extend their careers, and not put themselves in harm's way.
Yeah, it's an interesting concept because we think about these types of radiologic imaging technologies, and it's been made very safe. You get exposed to an imaging study, and it's very little exposure. But when you're doing that all day long, you're getting those little doses all day long, day after day.
Yeah, and some of those little doses aren't so little, but they do add up. And somebody also said, well, once I'm done, isn't that okay? And unfortunately, radiation isn't something like many of us go through the years of weight loss up and down, and you can put weight on and take it off. You can't take radiation exposure back. The stuff that you were exposed to a year ago, you're carrying that with you. That's a lifetime accumulation of radiation, and that has the impacts that we're seeing in some of these, unfortunate events, right? I think, I've been in the cardiovascular space for 25 years, and every physician or nurse that I talk to says, I know somebody who's had cancer. I know someone who's had an orthopedic injury. So everyone's got that story. And then there's clinical evidence that's built with that too. But those little pieces add up. What's interesting, and this was kind of interesting coming into this, our CEO is a physician and has studied this for a long time. He kind of looked and said, the reality is that these workers are exposed to more radiation than a nuclear power plant worker. I mean, think of that, right? It's
Hard to
crazy to
imagine,
think
really.
about that. Yeah.
Yeah.
So, and every day they're putting themselves at risk. So there's been a problem there for a long time, but I think one of the things that we found is people didn't talk about the problem because there weren't some great solutions. And so, it's like, why go solve and talk about an issue when you can't do anything about it? And so over the last several years, with the introduction of egg medical solutions, with the egg nest and the evolution we've had, which is a fun one that I think we'll talk a little bit about. We've been able to provide that solution to get people to take them from, where you were exposed to levels that were beyond what a nuclear power plant worker to, in some instances, 97 and up to almost 100%, 99% plus reduction in the exposure rate that you're there. So you can go into, a procedure and say, I'm not now putting myself at risk to go treat these patients. I'm not, going to maybe have cancer or cataracts or an orthopedic injury that may sideline me. So that's it's been a very interesting and growing area. From both industry side, from research side, but the clinicians have been kind of clamoring and saying there's got to be something better.
Now, with these types of changes, you mentioned the intimal thickness. I know cataracts is an issue, and some particular types of cancer, and locations like on my left side in particular, as you mentioned, that are more exposed to the radiation. Is it being tied to my work? Do you follow me, such that now it's a work-related injury, or is it just have they tied that together yet?
Yeah, so that's a great question, and I think that's one of the challenges that we've seen. So I know, for example, one physician who's talked about his story quite a bit. Dr. Karyakis, a thought leader in the space. He was out of work for 6 months because of the injury that he sustained from wearing the heavy lead aprons for a period of time. I mean, there's stories like that that are attributed. I don't think he filed workman's comp and all that stuff, but he wasn't there treating patients, which has an effect on the patients, but also on revenue for a hospital. But
Mm-hmm.
specifically, are hospitals tracking to see that when somebody goes out for a radiation-related injury, an orthopedic-related injury connected just to this? I don't think we've gotten down to that level yet, but in some of the discussions with hospital administrators, I think they all say, "Hey, it's very real, right? If I lose a physician like Dr. Karyakis or anybody else for that period of time, it's revenue lost, but I'm also paying to help them get back, and hopefully they make it back to work. So I think we'll see more of that as people start raising this awareness. But unfortunately, there's also been the litigious side of it, where it's happened in some areas in southern Indiana. There were some vascular surgeons that were exposed, and they didn't provide the level of protection they felt, and so there's legal action. And of course, that's not the best course. The best course is just to solve it before it actually gets
Sure.
there.
Yeah.
But
That's kind of the
yeah,
thrust of my question really was, if that's kind of becoming the way things are now, is that as those people on these teams and their physicians are developing some of these injuries or manifestations of radiation exposure, that it's starting to hit the pocketbook from that direction as well. It would seem like that might be a motivating factor to maybe update our technology a little bit to use a solution like this.
yeah. I mean, I think you've got a great point, and I think you can do kind of cost calculators to do that. But one recent statistic came up was what it costs to just recruit a nurse.
Right.
So if a nurse, and it's 50 to 70,000, which I think maybe on the low end when you
Mm-hmm.
factor all that in. But these nurses are exposed as much because they're up at the head of the bed, treating those patients. What's interesting is kind of the backstory of how we developed Egg was we actually went in and put radiation sensors all around the room, looked at where the highest doses were. And what we found was up at the head of the bed, where many nurses are, anesthesiologists, echocardiographers, is the most dangerous position in the room. So,
Interesting.
if a nurse leaves because they feel unsafe, or they leave because of an injury, that has an economic effect for the hospital. So I think you're right, CW. The economics are there to help pay for these solutions like Egg Nest to be out there, that mitigate some of the downstream effects.
I got to ask, Egg Medical, what was the inspiration for the name?
Well, like anything, there's a great story behind this, and I've heard the story a bunch of times from our CEO, and he says, there's a lot of bit of luck when you go into something like this, and I'll tell you that part. He goes, there's some friends and wine, and so when Dr. Bob Wilson, created this and brought this product to market, the early version of this product had it looked quite different than it does today, right? Part of being part of a startup is this idea of feedback from customers, rapid iteration, and then getting those back out to the field. And that's been a fun part of being part of a small, nimble company like this. Um, but the early one actually had much bigger sides on it, and kind of looked like a shell. And Dr. Wilson was at a dinner with somebody he had founded another company with, and they were talking about what he's doing. And he showed him a picture, and he goes, it kind of looks like a shell, like, a protective shell. And I think he did say there had been a couple bottles of wine at that point. He goes, "That's a brilliant egg. I like it." And it really fits with the theme. And so, then he said, as you look at trying to start a company, coming up with a name that's both catchy, short, it's not easy to find. And so he's like, I went home, dusted off the wine, and then typed in, "Hey, wow, there's no trademarks on that, right?
How about
That's
that?
there." And Egg Medical was born. So and it truly does really fit with what we do, which is provide this kind of shell of protection around that fluoroscopy, so that, and to keep the radiation in. So and plus, with a name like Egg Medical, we have a lot of fun internally with puns. Like, when somebody comes up with maybe a not a great idea, we say it's not all it's cracked up to be. And so yeah, there's a little bit of fun with that too. So
Well,
yeah.
stick on that for just a minute. Describe a little bit more what we're talking about, because obviously, historically, we're wearing heavy vests, and they've got big walls with giant plexiglass windows and stuff like that. But describe the actual technology that you're using, because it's more on the bed or around the patient more than the team actually wearing the big heavy leaded vests and so forth.
Yeah. 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 And I think, with the heavy lead aprons, one kind of other analogy to this is that none of us would go to the beach and wear a tank top and expect to not get sunburned. So while those heavy lead aprons have been around a while and they protect you, they act as a filter, just like anything. They're only protecting this part, right? It's like wearing a tank top. So your arms, your face, sometimes your long bones, right? Those are all exposed to that radiation. So our concept was we took that idea of the leaded apron, and it's a non-lead equivalent now material that they use in most of these things because lead's harmful. It works very well, but the same non-lead equivalent material. And so we put that around the procedure table. So we kind of take the weight of the aprons you were wearing and bring it closer to the source. And so our solution sits on the procedure table. It goes all the way around to provide a 360-degree protection because you've been in the rooms. They're not stationary. Patients,
Right.
have to be worked on from the head, the legs, the left side, the right side, and so providing that level of protection and that flexibility. And so we use that non-lead equivalent material. Our system's designed to be modular, so there's components on it that you might need for a structural heart case that you may not need for an EP case to do a device in a pacemaker or defibrillator. So you can put those on and take them off. So the flexibility that's there, I think, is also something that's important. As we designed this, there were kind of a couple things that you kind of come in as one, product's got to work. Does it reduce scatter radiation and protect those folks? But it can't get in the way of what they do every day. Some of these facilities are doing 8 or 10 procedures a day. And if you add 10 minutes to those procedures,
Right.
then they have to eliminate, either they're paying overtime or they're eliminating a procedure that they could have done. And so part of the design was, how do we make this fit into the workflow that they're doing today? And, I've been in the medical device space for a long time. I start to date myself, but I used to always go, I want them to remember my product. And our product is one that it's great. Sometimes people walk in the room and egg nest is all set up, the patient's draped, and they're getting the protection. And a doctor will turn to me and go, well, where's the egg nest, right? Because they can't see it. It fits that seamlessly into their workflow that they don't even know it's there. And so, and again, I can't take credit for that. That's really in the design of our engineers, our co-founder, John Gaynor, and Dr. Wilson came up with that. But now it's the feedback we're getting from customers to say, hey, we've got a new procedure. Can you modify it to do this? And that's what's really fun about being, I think, an innovative small company, to listen to those customers and respond to those. And as a sales guy, we like to, listen to everything, but you can't, right? You have to go, hey, I hear this 15 or 20 times in the field. That's a project we should go do. But there's always a one-off type thing that, the local sales reps like, we've got to make this. And, sometimes you just can't do those types of things. But the innovation has really been fun to see evolve, even in the last 3 years since I've been a part of the company.
Talk about that a little bit more. What sorts of ways are you seeing either the materials that you're using that are even getting lighter, or whatever the case may be? Can you talk a little bit about some of that? Because one of my colleagues used to be at Egg, and described the fact that that's one of the things you guys are constantly doing, is updating and innovating on the device as it stands from where it started.
Yeah. Well, I mean, I think when we started out, you were talking about the, interventional cardiology. And so again, it was born in that space. But then quickly people said, well, I do way more in this room than interventional cardiology. So as we listened to the customers, they said, okay, so what are the other procedures? And, part of this is that feedback loop, having, I think, a good field team, clinical, selling, and then the engineer team tied together. I think that's one of the nice things about that, is that we have a very good communicative relationship. And so when a customer was out there, we were out there in the field, and our product was really designed, focusing on interventional cardiology. And then we would send engineers out to the field to go watch, vascular cases, structural cases. And so we added like a structural head box to our system about 3 years ago to protect the anesthesiologist and the echocardiographer at the head of the table. So because they're getting radiated quite a bit, we've added some additional shielding. People said, hey, 97% is great, but I'd like to get to the point where I don't have to wear lead aprons at all. And so we said, okay, how can we innovate to do that? So we added a shielding system that actually can be mounted from existing shielding that's in the room. So we can come into a hospital and take that down and put that up. So, really it's about innovating and listening to customers' needs. One of the more recent ones that I think is really exciting is, customers said, "Hey, we love the egg nest," right? We were installing it, but many times we had to do a lot of construction work to, retrofit a cath lab to fit our shield in. And economics are tight, right? And hospitals also say, I don't want my room down for 2 to 3 days because that's revenue I'm not
That's a
getting.
lot. Yeah.
And so our engineers took the task of saying, okay, so here's the problem statement, right? We're maybe having to do a lot of work. There's some construction costs. How can we do that? So we came up with a newer solution, and we now have a shield that can actually retrofit and mount into existing boom arms that are in the ceiling. So what used to be, and what others in the space still have to do, is kind of come in and, hey, we're going to add some unistrut to the ceiling, and then we got to pull your room down for 2 to 3 days, and maybe spend upwards of $100,000 in some states like California, where you have to get some extra permitting. We can come in and, at the end of cases, at the end of the day, I was just in one, in 45 minutes, we retrofit that room with an egg nest, and it goes from no protection to 99.9% protection.
Oh, that's
And the
awesome.
next day they walk in. And so that's some of the innovation I think that has been really fun to see and be a part of. And again, in my previous world, those types of innovations took 10 or 15 years to get to market. So it's really fun when you're able to be a nimble company and really respond to the customer needs like that.
Well, obviously, it's getting noticed, the things you're doing. I saw that the company was recognized by the Global Cardiovascular Awards in 2025. You want to talk about that?
Yeah, so that was a real honor. The Global Cardiovascular Awards kind of looks out and says, "Hey, what are some of the innovative things that are happening in the space?" And we were nominated for that category, and then ultimately selected to win that. And I think, again, the awards like that are great to get, and it's an honor, and you can kind of put them out there. But I think what it really speaks to is it helps educate people on the, hey, what is egg, right? There were many people out there that saw, hey, you won the Global Cardiovascular Award, and then they like Egg Medical, and a doctor then kind of went through and said, actually, I didn't even know that existed. I need that in my area. So I think, to me, the getting the award is an honor, but the fact of it's sharing that there's solutions out there, like the Egg Nest Complete. We've got a product called Egg Nest Protect. That to me is even more important because it spreads the word. We're still at the very early infancy of this. We've had a ton of success, and others in the market are also out there. Um, but when you look at, there's 34,000 labs that have fluoroscopy in them across the world. And today, whether you combine everybody, right, Egg Nest and other people in the space, it's less than 1% of those are protected. So there's such an opportunity to provide that protection to nurses, doctors, and others. So, we've had a ton of success in year over year growth of 200 and 250%.
Yeah.
It's been amazing, right? That's also a fun thing that I haven't been a part of before. I've been part of growing organizations, but to grow at this level
Yeah.
presents different challenges too. But those are good challenges you can solve for. So, yeah.
Well, congratulations on both your award as well as the rapid growth. Though I can see, I mean, good ideas are just good ideas, and clearly, what you all were doing with this technology is very innovative. It fits right into what we're talking about here on our show, and it's making an impact on now a good number of people and growing at a rapid rate. You want to have any other topics we want to make sure we cover before we let you go?
Yeah, again, I'd just say thanks. I mean, I think, the having the ability to tell the story of innovation, and what that brings, and I think also challenging people to think about things differently. Again, Egg was born from an interventional cardiologist's idea, and our CEO actually happens to be married to a nurse, so he's like, I can't solve the problem just for me, right? This is about total team protection. And so, as people are out there listening to those, there's a lot of great ideas out there. I'd say, partner with industry, right? Partner with, whether it's big companies or small companies. The physicians and frontline workers, the nurses and techs often have some of the best ideas. And, sometimes you just need, avenues to do that, whether it's with a company like Egg Medical or, people like you that are connected to other people. I think is a great, thing for them. And I just, again, for me, this has been a journey, but a very fun one of, where we've been, where we're growing to. And our mission is, what I tell the team, and we got a big company meeting later today. We want to protect everyone, every person, and every type of procedure. So, and until the day comes when we stop seeing headlines of doctors or nurses are out of work because they were exposed to radiation or orthopedic risk, our work's not done. So, so I appreciate the opportunity to kind of tell our story, and hopefully maybe people go, "Hey, I've never heard of egg before. Wow, I need that." Right. And I think you kind of find that is the case. I'll tell you one funny story. I was just at a big meeting and meeting with a bunch of other colleagues, and they were like, "Oh, this is great. It really helps in cardiology." And these gentlemen ran kind of the GI and endoscopy division of another company, and they were like, "Well, wait, it'll work for us too." And I'm like, "It will."
Yes, as a
So, but
matter of
they
fact.
hadn't even really thought of that.
Yeah.
So that's what's fun about this is the ability to kind of go to different places. And so today we're in those. The future is orthopedics, urology, GI. Expanding
Hmm.
the egg nest solution to all of those places. And like I said, the mission is protect every person, and until we're done with that, so we're going to be working hard at bringing new innovative ideas to market.
Where do our listeners need to go to get more information?
So if you go to our website, that's probably the best spot, eggmedical.com. And you can kind of, if you just Google Egg Medical or Egg Nest, there's a bunch of great data out there, clinical data. And we're installed in, over, 300 and some facilities across the US and then globally as well. So the odds are pretty good that if people wanted to see it, they could just go probably down the road somewhere in Chicago or somewhere in wherever they are to see it and go, "Hey, I need this over here in lab 3 or 4." So
Well, Gavin Philipps, Chief Commercial Officer, sorry, with Egg Medical. I appreciate you making some time today. I think the product that you guys are producing is very intriguing and quite a cool piece of technology for a solution solving these people that are getting exposed to radiation every day in their workplace. So it's very fun to have you on and be able to amplify the story a little bit further for you guys. It's the kind of thing that we like to talk about here. If you haven't done so already, make sure you follow us on LinkedIn. We're on all the social media platforms that you're probably on. And we're also streaming the podcast on Spotify and iTunes podcasts. So we're there where you are. Hope you like us and follow us so you can hear all of these great innovators like the people here at Egg Medical. Gavin, I really appreciate you making time today, man.
yeah, hey CW, thanks for having me, and look forward to watching the next podcast too after this one.
All right, man. We'll see you next time. Stay tuned.
All right, thanks.